Welcome back to The Blend. Go Red for Heart Month. Know your numbers so your health stays in the clear.
Joining us with more is Dr. Keith Boman, Chief Medical Officer with Well Health Quality Care and a board-certified cardiologist. Good morning and welcome.
Hey, good morning. Nice to be here.
Nice to see you. Now, as we all know, February is National Heart Month. Why is that, dare we say, close to your heart?
I've been practicing cardiology and taking care of heart disease for 34 years, and the American Heart Association finally is moving into bring awareness of heart disease, and that's what February is all about.
It's incredibly important, and the numbers in America for heart disease are huge. Now, today is February 6th. What makes today so special?
Well, today is an awareness day for heart disease in women. Heart disease is usually associated with men, and the reality of it is it's very prevalent in women. In fact, as women get older, they surpass the prevalence of heart disease from men.
Wow.
And are the symptoms in women the same as men, or do we know it when we're having heart problems?
Well, many times they are, but sometimes women have a little bit of different symptoms than a man would. Typically, symptoms are chest pressure, maybe discomfort in the arms, but women sometimes frequently will have sweating episodes or maybe some back discomfort. They just present a little bit differently.
Interesting. I know heart disease is a thing that Americans have been struggling with more and more so over the years. Knowing your numbers is very important. Slight changes can be big. So let's talk. You have some questions for us. Your pop quiz.
Okay, well, the first question is, what is your normal cholesterol?
Oh boy.
Normal. All I know is HDL and LDL. The H is good, right? The higher the better.
Okay, H is good and the L
is not good.
We call it lousy. It's the
lousy, got it.
That's how you remember
So it's a numeric value. Is it 80?
80 would be wonderful.
How about 180?
How about 130?
Oh, that's perfect.
Okay.
We like to see 130 or less. However, if you have risk factors for heart disease, which we'll talk about later, diabetes or hypertension, we want the LDL to be lower than that. That's the minimum low number is 130. We like to see it even lower than that.
Interesting.
All right, we just flunked. Let's continue the pop quiz, okay?
Number 2.
What is number 2?
What is the normal blood pressure?
Oh,
Normal blood pressure.
I do know this because I'm actually going to a doctor's appointment today because I have high blood pressure. Are you ready?
I'm ready.
120 over 80.
You win.
Yes, there we go. All right, good. I sadly know a little too much about that today. Yeah.
Now, the one caveat for blood pressure is as you do get older, in 50s, 60s, and 70s, a normal blood pressure normally does rise. So if you were 70 years old and you had a blood pressure of, let's say, 140 over 85 or even 90, that's still acceptable.
Okay.
I just remember systolic and, is it diastolic?
That's correct.
The systolic
is the top.
Yep.
Diastolic is the bottom number.
Okay, so we got to keep that in mind. So work on that if it's a little too high. Now you have one more. Is it one more pop quiz question for us?
Well, you hear frequently the terminology body mass index, BMI, and people say, what is that? BMI is just an attempt to take into account your body size and relate it to obesity. So a BMI, if you calculate it utilizing your height and your weight, should be under 30. So a BMI over 30 typically suggests that we are overweight. So I calculated my BMI before I came over here.
How are you doing?
I'm okay. I'm at 27.
Okay, that's good. For some people, though, like if you are really built like an Arnold Schwarzenegger, his BMI, he would actually be considered obese on that scale. But for the normal body,
that's correct.
Like
and you do have to take a few things into consideration. I will tell you, though, for men in particularly, waist size is also a risk factor for heart disease.
Wow.
But the waist is taken at the umbilicus.
Where's that?
Right up here.
the stomach, at the belly button?
At the belly button, yeah.
Oh, no.
Is that the fatter part versus going a
That's
little
correct.
lower?
Oh, that is not good.
Yeah, we have men come in frequently and say, really, I'm not overweight, but they wear 42 size pants, but they measured it
But what if they're
somewhere.
6'5" and 42 size pants? Is that okay? Or
They're probably a little
That's still
over.
a little over. Okay.
Well, let's put this all in perspective. What does unhealthy really look like? You actually brought in a model here to kind of take a look.
Well, we're talking about heart disease, which is the same process in men and women. And it's arteriosclerosis. This is plaque that forms in the arteries, perhaps to the brain or to the heart. A stroke is the same thing to the brain as a heart attack is to the heart. It's the same process. And you might focus in on this. This would be the inside of a normal artery.
That's perfect.
But over a period of time, particularly if you have diabetes or high cholesterol or hypertension, we end up coming down here where you see a plaque that gets inside the arterial wall.
Oh, wow.
And of course, this is much enlarged from what is normal.
Of course.
what happens with the plaque, it becomes unstable, it cracks just like a cut. And the body doesn't know if it's on the outside or the inside of the body and forms a clot. And it's the clot then that blocks the artery in the blood supply distal to that point.
Wow.
That's what causes a stroke. That's what causes a heart attack.
Well, it's very important to catch it early, and that's why we go to see you.
That's why we want to get that plaque before it gets down to this stage.
Of course. Doc, a pleasure as always.
Pleasure's mine. Thank you.
Thank you so much. There are locations valley-wide for Well Health Quality Care. For more information, just head to the website or call the number on your screen.
It's Heart Month, so know your numbers all month long. Well Health Quality Care is offering free blood screens during your scheduled visit.
Don't put it off. Up next,